Hi, my name is Lise Alschuler. I'm a naturopathic doctor and have board certification in naturopathic oncology. I've been practicing for over 20 years and do a lot of educational things. I am a clinical professor at the University of Arizona and teach in the fellowship program there, and am the executive director of TAP Integrative, an online educational resource for integrative practitioners, and also co-founded a survivorship application for web-based survivorship application for cancer survivors. And I'm just really delighted to be part of the upcoming ACAM conference. And I love that and all the things I do because I absolutely love being a practitioner in the integrative medicine field. I think this is the medicine of the future. And I've been watching it emerge, and I think we're continuing to emerge and really infiltrate conventional medicine. And it's such a good thing for patients, for providers, for the health of our human community. And so I'm delighted to be a part of it. I feel like there's nothing more wonderful than to be in love with the work that you do, which I am. I think integrative medicine, as I said, is really the medicine of the future. And I think having that confidence going into this specialization or this field is very important, because that confidence will pervade how you learn and how you communicate what you learn to your patients. And I think it's also very important to really approach integrative medicine with both heart and mind. So by that I mean we want to be heart-filled practitioners and connect with our patients, form healing or therapeutic relationships with our patients, which is so needed in healthcare right now. And so that's the heart part. And we have to do, in order to bring our hearts to our practice in that way, we have to be willing to do some soul searching ourselves, to walk our talk, and to just have a life of integrity and to bring that to our studies. And I think we need to bring our mind too, and we need to bring our skeptical mind and be skeptical of what we learn and look for evidence to support what we want to utilize. And make sure that what we're doing is going to be of benefit to people and of minimal harm. So I think that combination of kind of a skeptical mind with an open heart, that combination really creates a powerful practitioner. So I am a cancer survivor myself. I'm a breast cancer survivor in my 10th, actually 11th year now of survivorship. And that experience really brought me through the journey of illness in a very acute and obviously personal way. And I also was both daughter and partial doctor to my father as he was going through his journey with pancreatic cancer. And, you know, these experiences really clarified for me the importance of recognizing and encouraging the opportunity that illness can present as a transformative experience. It can really turn one's life inside and out, but what comes out of that can be tremendously impactful and really ultimately healing to both the person diagnosed and to their family and loved ones. So with my own experiences, I became much more acutely aware of that element of this illness in my patients and work hard to be open to that in discussing things with patients, to encourage them to continue to explore that part of their journey. And so in that way, sort of be a change agent for them so they can really utilize or gain as much as possible from a very difficult, in the case of cancer, journey. So one of the presentations that I'm going to share is really a collection of some of the learnings that I've gained from people that I've worked with, and it should just remind us more often, I think more than anything, of some things we know deep inside us, but maybe we don't always pay close attention to or allow ourselves to bring forward into our patient encounters. I think, you know, ACAM has been around for a long time, which right there says a lot. I mean, there's a certain role that ACAM plays in terms of being at the vanguard of integrative medicine, creating a community of integrative practitioners that can support one another, can learn from one another. And so I'm really delighted to be a part of that. And I've, you know, really enjoyed what I've come to learn about ACAM and the people that have been involved with ACAM in leadership roles and other co-presenters. And then most recently, as the executive director of TAP Integrative, which is a nonprofit educational learning site for integrative practitioners, where we take the best clinical understandings of experts in certain conditions, and we bring that information forward, we peer review it, we give it an evidence base, so we make sure that there's some evidence to support the approach, and then we put that into this website in a very digestible format. And I'm delighted to be able to offer that free to ACAM members. And that's something that I feel good about, because it's really just another tool that people who are invested in continuing their own education can avail themselves of. And I think that's what ACAM is really about, is continuing to improve how we are as integrative practitioners. What we can't get online and we can only get at conventions like the ACAM convention is community. And that is not to be undervalued at all. Community is essential for us as practitioners, particularly in the field of integrative medicine, where we're still not mainstream and we still have to assert ourselves to gain both patients, to gain respect, to gain reimbursement. I mean, there's lots of challenges that are out there for integrative practitioners, and it's hard, perhaps even impossible, to face these challenges as a single solo practitioner. So I think when we come together as community, we can share what we're learning, what works, we can gain a sense of camaraderie and regain inspiration. It's very, very likely that you would leave the convention feeling rejuvenated, re-inspired, invigorated to go back into your practice. And that's important, because the last thing we want to do is burn ourselves out in this sort of isolated place. So I think that for that reason, conventions are absolutely important. The other thing I would say is that, you know, I present at a lot of conventions, and when I'm presenting, I really am I'm trying to bring my A game to the presentation. So I'm fully there, and I'm doing my best to give the best distillation of the information I have. So I think the presentations that we get at conventions tend to be really top notch, and so that it's a way to really get the most information possible.